Hey, what's going on, everybody? Eric Levi, the Holistic A-Hole here, coming at you with a new video today. Today, I want to talk about a very interesting article I saw in Forbes magazine or Forbes online, because who reads magazines anymore? The liberal elite. This one is titled, let's go to it. Bernie Sanders was lucky he didn't have his heart attack in a single-payer system. And personally, quite frankly, I couldn't agree more. I was very shocked to see an article like this come out of the mainstream media, because I feel like in some regards, it is the mainstream media that's really pushing this Medicare for All, single-payer, government healthcare plan on the people right now. And one thing you'll come to learn about me if you're new to my channel is that I'm not a big proponent of government doing really anything, but most importantly, I am definitely not a proponent of the government providing healthcare. Definitely not a fan of the government providing healthcare at the expense of increasing people's taxes. Now, I get it. People will say things like, oh, Eric, you're full of right-wing Republican talking points. And now that might be true. However, I have no reason to be a Republican. I have no reason to have right-wing talking points. I'm using this from my own personal experience in the healthcare system, both as a patient and as an employee in healthcare. I used to work in healthcare. I worked on both sides. I worked in the patient side. I worked in the billing side. And when people talk about the problem with healthcare, there's so many problems with healthcare, and insurance is just one of those. Then you also have the problems with, the providers. And then most importantly, you have problems with the patients. Patients just don't know what they need out of a doctor. So this is why you have so many problems in the healthcare system. This is why healthcare spending is so completely out of control, because people go to the doctor most times. Now, I'm not including, emergencies. I'm not including, instances if you get hit by a bus or your baby has cancer. I'm talking about people who have the sniffles or have, some bruises or, have a chronic, sore throat or something. People go to the doctor, and the doctor, they just trust what the doctor says, and the doctor says you need antibiotics, and the patient says, okay, give me those antibiotics. And then the person takes antibiotics, and they go on rounds of antibiotics, and then they get sick again with something a little bit more serious, because what they did essentially was nuclear bomb all of the gut bacteria out of their microbiome, and now they have no protectant barrier. They have, leaky gut. They have dysregulated immune system. And then it's just a cascade of health problems. This isn't to say that I don't believe in the power of things like antibiotics and mainstream pharmaceuticals. I do believe that they have their place in our society. However, most of them are just completely overprescribed. People are just taking antidepressants and blood pressure medication and, cholesterol medication and blood sugar medication when they really don't need it, when the problem can be solved through more natural means like diet and lifestyle. So this is where I personally come from when we talk about things like a single payer system. I think it's a terrible idea. I think it's going to completely bankrupt the country. Not to mention, I believe the number of uninsured people right now is, I want to just kind of throw it out there, 30 million is the number I hear. And there's 330 million or so people in the country. So, what's that, like 90% of the country has health insurance. And, again, most people are overusing their insurance. But then you think about this issue of what happens when 30 more million people get insurance. I'm not trying to say that those people don't deserve health insurance. I'm also not trying to say that the people who have health insurance deserve their health insurance. Nobody deserves health insurance. You earn it. Most people work a full-time job for their health insurance, or they're so broke they're on Medicaid, which also has a long bout of a history of problems. So what happens now when the government starts paying for everybody's health insurance? What happens to the economics of that? What happens to the supply and demand? Most importantly, what happens when 30 million people come online with healthcare, and we know as a country in the United States that we're a very sick country. We have rampant chronic disease. We are by far the largest spender on our healthcare system, yet we have the most chronic disease of any country in the world. We have the most cancer. We have the most heart disease. We have the most diabetes. We have the most autoimmune diseases, right? And, a lot of people already, even with health insurance, aren't going to see the doctor because their deductibles are too high, their co-pays are too high. So it's not just the people who would get free health insurance from the government, but then the people who are underinsured now are going to the doctor. So my question is, where do all these doctors come from to see all these people? Because you go to any doctor's office in your neighborhood, most of them are already filled with patients throughout the day. It's very rare that you can call a doctor and they can say, "Yeah, I got the day open. Come on in." A lot of doctors make you already wait, a day or two to come to the doctor, let alone you throw on 30 plus million people with access to unlimited doctor's visits. Where do all the new doctors come from? Also, where do all the new doctors come from when the incentive to be a doctor, which is the, high pay, when that's all gone? Because are we going to still pay doctors, the salaries they're getting now, which for many doctors could be completely overinflated? A lot of surgeons make a lot of money because they sell people on a lot of surgeries. And a lot of doctors are very well compensated because they sell people on a lot of, pharmaceuticals and follow-up visits. But then what happens when we get rid of all that? What happens when we tell college kids, being a doctor doesn't pay like it used to? I know a lot of people get into medicine because they genuinely care about people, but I also believe a lot of people get into medicine because it's just a good paying job. So you think the government is going to keep that a good paying job? You think that our taxes are gonna pay the amount that it takes to continue for it to be a good paying job? You think wealthy people are just gonna subsidize this system to make sure that doctors can make, 6 figures plus? All the doctors who go to medical school and come out and become doctors, to all of them have good paying jobs? Also, let's say we start rushing people through the medical system. Medicine isn't easy. Medicine is very difficult. So when we start having doctors, surgeons, by God, that are completely unqualified and aren't very good at their job, what happens when we start having all of these malpractice situations come in? So I can go a long time talking about why something like a single payer system would be a disaster. But in the meantime, let's check in on our friend Bernie Sanders, who recently had a heart attack. And I'm not trying to clown on the fact that Bernie Sanders had a heart attack. I mean, it's very sad, but the guy's also really old. I think he's like 76, 78. For somebody in a high stress job like what is he? Is he a congressman or a senator running for president for the second time? Constantly traveling, constantly having to just be on, constantly just having to be so good at your job. It's very stressful. Not to mention having to constantly underpay your staff, less than $15 an hour, which is also the wage that you were vouching for all Americans to have. A lot is going on in the old ticker of Bernie Sanders. So this is why I found this article very interesting. It came across my feed today. Bernie Sanders was lucky he didn't have his heart attack in a single payer system. So let's go ahead and kind of pick this bad boy apart here. So at the October 15th Democratic presidential debate, Senator Bernie Sanders said, "Under the Medicare For All bill that I wrote, premiums are gone, co-payments are gone, deductibles are gone, all out-of-pocket expenses are gone. We're going to do better than the Canadians do, and that is what they have managed to do. I don't really know. I don't really know what that means. All out-of-pocket expenses are gone. Deductibles are gone. We're gonna do better than the Canadians do, and that is what they have managed to do. So they've gotten rid of all the out-of-pocket stuff, all the deductibles, all the out-of-pocket expenses. How are we gonna do any better than that? If you're already not paying anything, that's already. I don't know what we're gonna do. Are we gonna? Is somebody at the doctor's office gonna be like, "Thank you for seeing Dr. Meyerowitz, he really enjoyed his visit. Here's a $20 bill just for being a great patient of ours. We're going to do better than the Canadians do. They stink. And they like hockey. That sucks. Nothing against hockey. If he'd been subject to Canadian-style healthcare, he might not have been on that stage. About 2 weeks before that debate, Senator Sanders complained of chest pains. He went to the emergency room where doctors discovered that one of his arteries was blocked. Just hours later, Senator Sanders received an angioplasty procedure to clear the artery. Within days, he was back on the campaign trail. This kind of immediate, high-quality treatment is routine in the United States. Whether the patient is wealthy or poor, has insurance or not, is irrelevant. The care comes first, and the result is countless lives saved. But that's not the case in Canada, which adopted its brand of Medicare For All decades ago. There, patients in need of medical attention, even those in need of urgent care, have to wait and wait and wait. And so it's funny because whenever I discuss this topic with, with people on the left or people who are in favor of Medicare For All, what they say is that this idea of healthcare taking a long time and having to wait long wait times to get a procedure done. They say this is like a Fox News Republican talking point. And to me, I don't really watch Fox News, so it probably is because they're a right-wing leaning network, and I would imagine, this is a good way to kind of debunk the effectiveness of a single-payer healthcare system. But at the same time, to me, this is just simple logistics. If you have, like I just said, 30 million people enter the health insurance system, and then also the underinsured people now are able to go to the doctor, not to mention people who might be adequately insured but just don't want to pay any out-of-pocket costs, going into the doctor when you get the sniffles or a sore throat or maybe a little achy joint or whatever your problem is that maybe you wouldn't have seen the doctor before in the past, now that becomes way more realistic. It becomes way more attainable. You can just go to the doctor. You don't got to pay for nothing. So just go to the doctor. And when we all start thinking like that, when we all start saying, hey, let's all just go to the doctor, again, where are all the new doctors going to come from to meet this demand? There's just not enough doctors to see all the people who are going to need to get medical care. So yeah, you're naturally going to have longer wait times. Not to mention, for doctors right now in America, in our current medical system, and it's been like this for a long time, doctors can only see a patient for about 15 minutes. Now, this is general care practitioners, which is when we talk about going to the doctor, we're talking about general care practitioners, okay? If you're going to see a specialist, maybe you get a little bit more attention, but I also don't think so. I think you also only get about 15 minutes with these doctors at a time. So either our wait times are going to increase, or the time you spend with a doctor is going to dramatically decrease, which when we talk about standard of care, that is a terrible standard of care. The body is a complicated system, and to think that you can completely and fully and accurately diagnose a patient in 15 minutes or less is pretty ballsy. So this is why we have so many problems with misdiagnosis, with iatrogenic death, which is the death under the care of a doctor, like when people die from complications with their medication, because again, they're misdiagnosed or they're over or under prescribed something. This is where the problem with healthcare comes in. This is why medications are such a problem. And by the way, doctors are not allowed to not have you get a medication when you go see them. When you go see a doctor, you cannot leave there without, some kind of medication. In fact, this isn't because doctors are corrupt and insurance companies are corrupt or pharmaceutical companies are corrupt, which they all are. It's because patients go in asking the doctor, and in many instances, demanding the doctor give them a drug or give them a procedure. This is the world we live in. When you turn on your TV and you see these direct-to-consumer pharmaceutical ads, like if you're trying to watch a football game and you start seeing, a guy in a rowboat talking about how his blood pressure, used to be too high and he lowered it with Chantix or whatever the blood. I think that's a smoking medication. Whatever the medication is for blood pressure. Patients see that, and then the next day they call their doctor and they go in and get that medication. So it's not just that doctors are prescribing this stuff a lot, it's that patients are going in and demanding their doctor give it to them. So the weight problem, if your only response to that is that it's a Republican talking point, you are an idiot. You're just a dummy. Respond to it with something, because if you truly believe that Medicare for all and single payer is the answer, well, this is a huge stumbling block. This is a huge problem. And again, if Bernie Sanders had this heart attack, or if you or anybody had a heart attack and you had to go to the doctor, and because we put, millions of more people with unlimited access to healthcare into the system, you better hope there's more doctors coming into the system to meet that demand, which it's not really possible. It's not really possible to start training people at that scale to be doctors. So Canada's waiting woes date back decades. A 1995 study published in the Journal of American College Cardiology found that 2/3 of patients in the United States who needed an urgent coronary angiography test, which reveals blockages in the arteries, got it within 24 hours. None did in Canada. Nearly 2/3 of Canadians had to wait more than 3 days just for the test. That is a long time. The situation has not improved in the years since. There, the median wait for an angioplasty is 3 to 11 weeks, depending on the province. That's after an appointment with a specialist, according to a report on wait times by the Fraser Institute, a Canadian think tank. Yeah, I have Canadian friends. I'm not proud to say that, joking. And they all are a little mixed on this thing, because I've seen it in both sides. I've talked to the people who say, yeah, wait times to get your healthcare taken care of in Canada is ridiculous. If you have a broken arm or whatever your problem is, if it's an emergency, you're gonna probably wait a while. You're gonna probably wait a while to get that done. I mean, an unreasonable amount of time, especially for Americans who demand things happen quickly, who demand instant results. That's gonna be a huge problem, right? And I have not heard many Canadians say that no, in fact, the wait time is not an issue. But again, like this article says, probably depends on the province. And I would imagine here in America, power corrupts. And at some point, to get around that, it's going to come back to the people who have the money, who are able to pay the most, are going to be able to get into that doctor to see them faster. That's just what I'm predicting. Because people in America are very impatient, and we need our shit done now. So, that's not the one. Okay. Patients in need of cardiac procedures also face absurdly long wait times. In British Columbia, for example, patients face a median wait of 2 weeks for an urgent coronary artery bypass surgery and 1 week for emergent coronary artery bypass surgery. The median wait for urgent pacemaker operations in the province is 3 weeks. In Newfoundland and Labrador, the median wait time for urgent coronary artery bypass and aneurysm surgery is 2 weeks. Many patients don't survive those waits. From January through April of this year, a dozen cardiac patients in Quebec died while waiting for surgery, which is amazing, because isn't the argument of a single-payer system that it's going to save countless lives and it's going to actually cut down on the costs of healthcare? If people are dying of these heart problems because they actually can't get in to see the doctor, I think that's the only way it's going to actually cut down on the cost of healthcare. Yeah, it's going to cut down on the cost of healthcare because people aren't going to be able to go see the doctor. They're just going to die. That's what's going to happen. You're just going to wait until you die. You're just going to wait because you need an angioplasty, or you need some kind of heart surgery. And hey, man, you can't just hire a guy off the street to do that surgery. You can't just pull people out of medical school. You need it's like a pilot. You need a certain amount of hours in residency and in training. And even when you get that, it's been very well documented that many surgeons still are not ready. Do you want to get a bypass surgery by a surgeon who just got out of medical school? Do you want that? Do you want a heart surgery? Do you want a bypass surgery by a doctor who's done less than 10 of those procedures? Do you want one who's done less than 20 of them? We're just going to die. That's what's going to happen. We're just going to die, and that's how we're going to save money. That's the plan. Long waits aren't the only problem. Oh boy. Just getting to a medical facility can be difficult. More than 1/3 of Canadians over the age of 40 have to travel an hour or more to find a medical facility that can perform an angioplasty, according to a study in the medical journal Open Medicine. Fewer than 20% of adults would have to go that far. Yeah, I don't think that's going to be an issue here because, we're Americans. We got cars. I think we're going to be okay with that. You're just going to get there faster and you're going to wait a long time. That's because Canada has one such facility for every 595,000 people. In the U.S., there is one for every 176,000 people. Again, we just crank out a lot more doctors, but maybe not enough. Many of Canada's emergency departments also provide substandard care. A 2016 report from the Commonwealth Fund found that 3 in 10 Canadians waited 4 or more hours in the emergency room. In Quebec, more than half of ER patients had to wait that long. In the United States, only 1 in 10 patients had to withstand those sorts of waits. So, it's gonna change things a lot. And look, again, in America, if we roll up into an emergency room and we can't see the doctor, you better believe if we can't see the doctor, we're gonna start flexing our entitlement, and we're gonna start flexing our, what do you call it? I said entitlement. We're gonna start flexing, our desire to see the doctor when we see the doctor because we're impatient. That's it. People's veins are gonna be popping out of their heads and be so stressed out. People are gonna go into the emergency room for a heart attack, and then they're gonna have a heart attack just because they're yelling so much at the staff. And by the way, who's gonna be the secretary at the doctor's office? Who's gonna want to deal with all the abuse that's gonna come from pissed off people? Is it going to be because, if you want to be a medical assistant, it's a pretty easy degree to get. You can just go to like a 9-month college or something. Do you want to deal with that person? Do you think that person is not going to be above just telling you to go F yourself? It's going to be ugly. That same Commonwealth Fund report found that 59% of our neighbors to the north had to wait more than 4 weeks to see a specialist after they were advised or decided to do so. In the United States, that figure is 25%. The last thing Americans should pine for is Canada's socialized healthcare system. Senator Bernie Sanders, of all people, should understand that by now. He doesn't. He doesn't understand that. Neither does AOC, neither do any of these crazy ass people, because they want to just tell you stuff that you want to hear. They want to tell you that you can have free health insurance, and that is totally doable, and that every, industrialized country in the world doesn't. But here's the difference between us and every other industrialized country. We are fatter, sicker, grosser, meaner, more impatient than all those other countries. We have disgusting food. We have people who cannot go 30 minutes without eating. We have kids who are obese and type 2 diabetic. Let's not even talk about the fact that when we put this online, if it does come, I have a really bad feeling it's going to come. And when it does come, you look at the Generation Y kids, you look even millennials, you look at the kids that are like, preteens, teenagers, the health problems they have. 1 in 4 of these kids is already obese. 1 in 4 is already obese, which means they have exponentially more health problems than their 3 out of 4 counterparts. And that is a new number. That number used to not exist. So in the next 30 years, these kids that are already obese as, 15, 16, 17-year-olds are going to demand more of the healthcare than people from my generation who are also obese and fat, right? And then the generation after me, and then the aging baby boomers. I mean, they're already sucking up all of the entitlements. So I ask you, dear holistic a-hole, where do you get all of these resources from that must be promised in order to make a socialized healthcare system work? Leave your answer down in the comments. Also, don't forget to give the video a big thumbs up because those are also very important. And I would love to know your response, your answer. You can hate on me. You can tell me I'm an idiot. You can tell me I'm a Nazi. Or, if you agree with me by chance and you think this makes sense, let me know down in the comments. Also, be sure to check out the Holistic A-Hole podcast. Follow me on all the social mediums, Twitter, Facebook, Instagram. Keep watching, everybody. New videos coming out every day. I'll catch you tomorrow. Thanks so much for watching. Peace.